everything in my life started changing. It went from being active to all of a sudden not being able to wash my hair or walk myself to the bathroom. And this happened within months. I'm Megan, and I had rapid diffuse scleroderma.
This is a devastating disease for patients. Your immune system attacks your body's different cells, and it causes scarring not only in the skin, but also in your heart, your lungs, your intestinal tract, your kidneys. So ultimately, your organs start failing.
I didn't know what was happening with me. My skin was tightening. Day by day, it was getting tighter and tighter and tighter, and it was becoming more and more painful. It was hard for me to swallow foods. Each day, it got worse, and there wasn't one day that I wasn't in pain. It was excruciating pain, and it never stopped. No medication, nothing. Nothing could control rapid diffuse scleroderma.
We chose to focus first on scleroderma as our first autoimmune disease indication because it has such a high unmet need, and it affects young people that have their entire potential life ahead of them.
I just had a newborn son, and I was being robbed of being a mom. Not only was I robbed of being a mom, I was robbed of being a business owner, a friend, a wife. Everything in my life started changing.
Scleroderma is an autoimmune disorder where the body attacks itself. The body turns on itself, essentially, and tries to reject itself. And there's really no good treatment for it. The standard immunosuppressive drugs are used, but they are what we call disease modifying, not curative.
The only thing that can work for severe patients is by giving you a stem cell transplant. And the purpose is really to re-engineer, in our case, the immune system. And that's the holy grail. That's something that all of us strive for, and we really like to see happen.
A common form of cell therapy is bone marrow transplant, because when you can transplant living cells, you can have so much more of an impact on the immune system than a drug would.
The stem cell transplant process was kind of a blur to me. The only thing on my mind was to survive and just do it. I had absolutely no idea what a stem cell transplant was. I didn't have an option to use a donor stem cell. The only choice I had was to use mine.
Autoimmunity is a breakdown of tolerance to your own self, to your own body. And it has been linked actually back to stem cells. And the beauty of transplanting healthy cells from healthy donors that don't have autoimmunity is that you can actually reverse that entire process and halt disease progression. It's like transplanting a new immune system that develops in the recipient, and it sees the donor as being part of self. And no drugs can successfully do that. At least none have done that so far.
In the FREEDOM-3 trial, we're going to be using our cell therapy to treat severe scleroderma patients. It's based upon over 3 decades of work by Suzanne Ildstad and her team, and it has a potential for helping thousands of patients, not only for solid organ transplant, but also for autoimmune disorders.
Through clinical trials, you advance the field because you're answering questions that have not yet been answered. And if you see success, then that makes it better for not only the patient enrolled, but all the other patients that will follow after them.
And I think it's important when you have something as rare as scleroderma that you do this, because think of how many other people you are helping. There are so many of us struggling, and we don't have an answer. We don't have a cure. But if it isn't for us to take that step and try, then we may never have a cure. I feel like I went through this process so my experience can help somebody else. And when I talk to others who've been through this experience, we say the same thing. We would do it again if it means that we could help somebody and help save a life, or help science. Science saved me, and I'll say it over and over again. This is the future. It's my future.